This is Dylan Lubau with the Global Workers Inquest into the COVID-19 pandemic. We're about to speak to Carrie, a nurse from Alberta, Canada, whose career was cut short in 2020 by long COVID. In this interview, we'll discuss Carrie's experiences as a nurse during the pandemic, the impact of long COVID on her life, and what she thinks must be done to end the pandemic around the world.
So I am a nurse. I was a registered nurse until October 1st. At that point, I chose to go non-practicing through our professional association to not pay almost $700 a year in professional fees. So right now I'm a nurse. I do have my bachelor degree in nursing and graduated in 2004. So I had quite a bit of experience prior to the pandemic. I've worked in a variety of places. I've worked long-term care, hospital, acute care, emergency home care, and my final position was as a teletriage nurse at HealthLink in Alberta. HealthLink is across Canada, and sometimes otherwise called 811. So that was my job there, and I answered the phones, and I was also a charge certified nurse, which meant that I did charge very frequently on all the shifts that I worked. So I was able to work the first month of the pandemic, and it was fascinating. In healthcare, we have a thing that we call Code Orange, and that is when there's a mass casualty event, so that we can kind of summon resources quickly and take care of a bunch of patients. Basically, COVID has led our system into being a code orange to this very day. I've never seen anything like it in my life. I did work the first month of the pandemic on modified duties, as I was already starting to get quite ill at that time. And the first month of the pandemic was like nothing I've ever experienced in my life. HealthLink in Alberta and across the country was the first point of contact for many, many, many patients in the beginning, or potential patients in the beginning of the pandemic. People were phoning there for information, and we really didn't have a lot of information to give in that first month that I was working. It was amazing. We would have our call protocols around COVID would change 3-4 times in a shift sometimes. So we were having to adapt to new information literally on the fly. New sheets would be handed to us in terms of what we were assessing, information that we had to give. And again, this would happen sometimes 3 or 4 times during a shift. So it was wild. We would have patients, they had to bump up the technical aspects of the call center to be able to accommodate more callers. We would have patients on the line for up to 8 hours on hold. And at that point, I was working evenings, and people would often have ended up falling asleep while they were on hold. And as soon as my voice came on the phone, you'd hear this mad scramble in the background because they were so afraid that I was going to drop the call. And so what I experienced in the first month of the pandemic was in a couple different phases. I would say probably the first 2 weeks was just mass panic. We had people calling about everything. They were all terrified. They were afraid they'd been exposed. They were afraid they'd been sick. And at that point, really not having a lot of information, we felt really quite helpless. And we could give them symptomatic treatment. And just, if you have a sore throat, this is some of the stuff you can do. If you have a fever, this is some of the stuff you can do. If you're having such and such symptoms, you should be going to the hospital. I would say the second part of the month that I worked, we went from the initial panic to a lot of anger with callers. The panic started to just kind of turn into anger, and people were very upset about not having the information, which was completely understandable because we as nurses and healthcare workers in the profession all felt the same way. And unfortunately, we just simply had to wait for the science to catch up to what was happening in real time on the ground. So there was a lot of just so much fear. And at the same time, it was fear with the staff because we also didn't know where it was coming from. Was it coming through ductwork? Was it somehow coming through water? Was it just free floating in the air that if you walked outside, we knew nothing about it in the beginning either. So it was like nothing I've ever seen before. And to this day in hospitals, they're not calling it a code orange. It's a code orange. It's massive amounts of patients presenting to a system that is wholly unprepared to handle the volume, on top of the volume that exists just on it in regular times.
Now, how do you place that in the context of the decisions made by the Alberta government of Jason Kenney, who infamously declared last summer that the pandemic was over and that Albertans were going to have the best summer ever? Did you see that coming even in early 2020 when you were working during the early stages of the pandemic?
Initially, no, because initially everybody did the right thing. With the limited knowledge we had at the time, everybody locked down. People were very compliant with masking. I mean, yes, there's always been people that weren't compliant with it, but in the beginning, I would say our reaction to COVID was very appropriate and very strong and very unified. I did see very quickly that things were changing politically. And of course, you don't realize how much politics matters until a time like this. It's kind of always, I think for most people, politics is like drywall. You just assume that it's there doing its job, holding up the place, and you don't really think about the drywall in your house. It's just there, right? You may lean on it time to time, you may paint it, you may put pictures up on it, but generally you don't ever think about the drywall that's holding your house together. And I would liken that to the government. Most of us just kind of did what we needed to do, and the government was there for the big decisions. Quickly, COVID became very politicized, and that's when everything started to change. I need to add that in the beginning of the pandemic, Alberta as a province was number 3 in the world for testing per capita. The testing was done through HealthLink, not done physically through HealthLink, but we facilitated it. We booked all the appointments, the clinics got going. In the first month that I was there at Link, it was a very organic nurse-led response, and we were number 3 in the world. So we knew what we were doing, and the nurses were kind of, the frontline nurses were just given almost carte blanche to bring about the processes to meet the pandemic questions. And we did very, very well at that until it started to change.
Now, you say you worked through the early stages of the pandemic, so at some point you stopped. Could you explain why you stopped working as a HealthLink nurse and how things have been going for you since that time?
So in late September of 2019, my oldest was traveling. He loves to travel around the world, and he's been many places. In late September of 2019, the place that he happened to be traveling at was about 100 kilometers out of Wuhan. He got sick during the trip, which is not unusual. People generally get sick. They've been through lots of airports, they've been around lots of people, not getting the sleep that they need and stuff. So that we weren't really concerned. He's picked up stuff before when he's traveled and come out just fine. And he did this time as well. He got home probably around it was somewhere, I want to say around the 10th of October of 2019. I got sick very quickly after that with a respiratory, a bad cough, and I couldn't breathe. And I've never had that in my life. I've never had that experience. And I was in emergency twice for that. It was horrifying. I had been sick with an autoimmune condition prior to that, but we were working on getting that under control. So anyway, after I got sick in October 2019, everything just spiraled on me. My body just I couldn't do it anymore. I desperately tried working. I was off quite a bit, but I did want to go back for the pandemic because I knew they needed help desperately. And I wanted to be part of that. I wanted to help people. And I'm glad that I did, but it came it came at a cost. I should not, knowing what we know about COVID now, I should not have pushed myself. But that was before we even knew that COVID was a thing. And ever since then, I'm on both federal disability and my work disability as well. So I don't work for AHS anymore, but I'm on indeterminate long-term disability.
Thanks for being so candid about your experiences with COVID-19, Carrie. What's happened to you and to countless other people around the world really amounts to a massive social crime carried out by government authorities, big business leaders, and the corporate media establishment around the world. Officially, the first recorded case of COVID-19 in Canada was on January 25th, 2020. However, some scientists estimate that there may have been isolated cases of COVID-19 outside of China even earlier than that. Can you talk about the impact that all of this has had on your career? You went from basically working full-time in a career that you loved to where you are now, which is not working in a profession that you've spent your entire working life in. Can you talk about how that transition has been and what support you've gotten from your former employer, from the government, and from your union, or the lack of supports maybe that you've gotten from them?
You bet. It's been devastating. As you said, Dylan, I have absolutely adored nursing. It was not just a job for me. I just got it. I was good at it. I enjoyed it thoroughly, and it made a difference. Really, really loved it. I did get good management support from my employer. Working with nurses, they know when you're sick. So in that sense, they were very supportive, and I should have probably been off 6-8 months before I was. They allowed me to just work as long as I could because they knew how devastating it would be. So I have to say, I did get very good support from my management. In terms of the programs and stuff, it's great to have disability. It's a very humiliating process to go through when you're applying for it and in the initial months of it. The goal of disability is to get you back to work. And so they're trying really hard to push you. And it was very difficult. I didn't get a lot of support outside of my family because you kind of drop off the radar. And all my friends, frankly, are in healthcare, and we're completely and remain so overwhelmed with workload that people just are tired and don't have the time. The government support, I was fortunate to be approved for federal disability the first time. That is not the case for a great many people, from what I understand. It's minimal. It's not financially. We did much better when I was working, I guess I would say, but we're managing. But I'm still at the mercy of disability. I can be taken off anytime just because. So that's a constant stress looming in the background.
So how's this affected your family, your spouse, your children? How has the pandemic and your experience throughout it affected them?
It's been really hard because they've had to watch me get incredibly sick through the pandemic when healthcare was very hard to access. I had a number of medical tests put off and postponed due to the pandemic, and in fact wasn't able to see my doctor in person until it was quite late. So I have a permanent feeding tube because of it. I don't know if the outcome would have been different had I been able to be seen and be treated more thoroughly earlier. That's something I'll never know, but I do have a permanent feeding tube for the rest of my life. So my family has been very stressed watching me go through this and essentially being helpless in terms of how can they help me? And I've always been a person who's been really politically aware. So we talk about politics all the time in this house, and it's not been easy, truthfully, for the kids because it's been horrendously stressful for anybody who understands what's going on. And so nobody in my family has the luxury of ignorance, unfortunately.
Now, can you talk about the broader political context as you understand it? Alberta, of course, is a province that was previously ruled by a social democratic government. The New Democratic Party lasted one term, and then they were booted out of office. The current government of Jason Kenney is letting the virus rip through the province. And as a result, Alberta has one of the highest per capita hospitalization and death rates of any province in the country, and in fact of any jurisdiction in the world. What has been the NDP response to this? How have they fought this let it rip policy?
I don't think the NDP has done anything, to be honest with you. They've asked for more information about the pandemic to be released publicly, which is great and which should be, because they're starting to obfuscate the data. But I see party members on the news media all the time out in public settings not wearing masks, and they're clearly pandering to the anti-mask crowd or the indifferent crowd. And so I actually left. I had been asked to run for the Alberta NDP, I want to say back in 2017, 2018, and I was going to, but my health had started to decline. But I actually formally left the party last year because I'm very angry at their lack of focus on the pandemic.
Now, when you look across the rest of this country, the pandemic situation in basically every other province is roughly identical. No matter what government it is, no matter what political party sits in office, they have all pursued roughly the same policy with regards to the pandemic, which is to let it rip and to dismantle all public health measures designed to stop the transmission of the virus. As a result, the public healthcare infrastructure in this country is crumbling. It's on the point of collapse. Healthcare workers are leaving the industry in droves. Can you speak about some of the more eye-opening and significant developments that you've come across in public health care during the pandemic and since the start of the pandemic?
Well, I have a pretty good position on it. Before I was at HealthLink, I was head nurse of our local hospital. And it's a small hospital, but it alternates between being the first and second busiest rural emergency in Alberta. So it's a small hospital, but it's a very, very busy little hospital. So part of my role was bed managing, and it was a constant issue well before the pandemic. Well before the pandemic. In fact, as a nursing student in 2004, I remember hearing, I believe they were called Code Burgundies, which is when they had a surge of patients in the emerge, and a Code Burgundy is asking physicians to try and discharge as many patients as possible so you don't have a bottleneck in emergency. That was back in 2004. Bed managing in 2012, 13, 14 was very difficult because there weren't enough beds at that point. So we were already on really shaky ground before COVID hit. It has since gotten so much worse, so much worse. And I'm horrified. I'm horrified at the federal government for releasing these billions of dollars to provinces with essentially no strings attached. And we've all seen the results of that. I'm horrified that they did that. I'm horrified at the provincial governments for the let it rip policies that they've enacted, and at the provincial medical officers of health across this country who have done nothing but obfuscate the data, the information. They've toned it down, they've soft pedaled it throughout this whole pandemic, and it's just getting more and more confusing to people.
You say you have a lot of friends in healthcare. What have they been saying throughout the pandemic? It's common knowledge that lots of healthcare workers are considering leaving the profession within the next year and maybe within the next couple of months. There are numerous studies and polls that show this. So what are your friends, your former colleagues, what are they saying?
The same thing. Staff turnover is incredible at places, and morale is low. They're tired. We're going on to year 3 of basically a mass casualty response, and now you're adding in patients are becoming more entrenched and difficult in their thinking. I'm seeing reports that, people are starting to request blood from unvaccinated donors, which is not feasible. I'm hearing stories from my friends about the abuse that they take from the public around masks, and even asking the simple vaccine question at triage, are you vaccinated? And I was speaking with my friend who does triage and emerge here a couple weeks ago, and she said it's ghastly. People just are abusive towards healthcare workers kind of en masse now.
Well, have any of your friends or colleagues left the profession since the pandemic started, citing some of these same reasons?
No, not yet. But then I've also been less in communication with people because they're so busy, and the last thing they want to do is talk with me about COVID, because it's kind of it's their whole thing. So I know people are kind of anecdotally looking to get out. I haven't heard the numbers like I'm seeing, but I also don't know that people are even necessarily voicing that right now to their colleagues, because it, nobody wants to let their coworkers down. And I think that it's probably something a lot of people are thinking about, but not actually discussing.
Now, when discussing the pandemic and the political response to it, both in Canada and around the world, we really can't even begin to talk about it without discussing the role of the unions and what they did or didn't do to protect their members and the health of their patients. So, as I understand it, you've had some experience trying to improve the pandemic response of your union, the United Nurses of Alberta. Could you perhaps speak to some of those experiences?
Yeah, I certainly can. I was actually a union local president for 2 years in Strathmore before I took the head nurse position. So I had some pretty decent union experience. And I have to say, at that point, I had full confidence in the union. This is prior to COVID. They seemed progressive, strong, proactive, kind. I've attended a couple AGMs in Edmonton, and it was quite something to see the amount of money the union was able to donate to other causes without a blink, because the amount of money they pay and they receive in dues is high. So I had a lot of contacts within, the upper levels of union leadership at UNA, and social media contacts. They have done nothing. They have done absolutely nothing to promote staff safety in COVID. I have not seen one meaningful action. And in fact, UNA is having their AGM this upcoming week in Edmonton. And I asked one of the senior leadership members why there wasn't a mask mandate, because online there is no mask mandate for this AGM. There's 900 nurses registered. So this is a sizable chunk of Alberta nurses are planning on going to this AGM. No mask mandate. She did tell me there is a mask mandate, so I'm presuming they're handing out masks at the door, but I don't know that members know that. My friend who is attending has been looking for something about masks and hasn't been able to find anything. So the most basic level of protection doesn't seem to be even on their radar. We'll see if there's actually people wearing masks. The thing is, when they eat, it's in a common lunchroom. I've been there, and it's huge. So you're going to have hundreds of people eating unmasked in a room. So even if the AGM itself is masked, you're going to have hundreds of people eating unmasked. So it makes no sense to me. And we're all registered nurses. We all know this. We've all done infection control. We've all worked with superbugs and influenza and H1N1 over the years. This is not new to any of us.
How would you say the union's rhetoric has changed throughout the past 2.5 years now of this pandemic?
There's been hardly any. They've been a non-entity, as has our professional association. There has been nothing about COVID and advocating for staff safety that I've seen, which is what horrifies me. I can even understand the association not getting politically involved, but the union, I can't. It just makes no sense to me at all. Absolutely none.
As I recall, you did try earlier in the pandemic to make suggestions about what could be done, and you had some dealings with officials from the UNA or perhaps from the Alberta Federation of Labor. Can you speak to that?
Um, yes, I did come across some information, and I'm only going to speak to this in a general manner. But yes, I did have contact with the head of the the head of the Alberta Federation of Labor, who's kind of the boss of union bosses, as it were, and he was not interested at all, at all, which spoke volumes to me. And I can't speak to it any more specifically than that, but other than to say the response was complete disinterest and wholly inadequate. And I was stunned. I was utterly stunned. I was not expecting that at all. I had come to him with information that was very important, and it was just not important to them at all.
When you look at the current trajectory of this pandemic, what is it that worries you the most when it comes to protecting the rest of the population?
The normalizing of mass death. And it has become completely normalized. Personally, I can't get past the people in Italy being buried in pits in the beginning of the pandemic. I can't get past the morgue trucks outside the hospitals in the States and the possibility that we were going to need them here and the field hospitals. I can't get past that. We have some treatments. The vaccine has helped decrease hospitalizations, and that's fabulous. But what's happening underneath that is there's a whole bunch of people who think COVID is mild, who are getting infected, who have no concept of the interior, of the inner damage that COVID is doing. It is not a cold. It is a vascular, neurological, gastrointestinal, cardiac virus that is changing our immune systems. And people are getting this over and over and over. It's not like a chickenpox party that we used to have, and I had with my own kids in the days before COVID was a thing. Before the chickenpox, the varicella vaccination was a thing. You got chickenpox once, you were done with it. You don't get chickenpox again. COVID is not like that, but people are thinking that it is. And they're thinking either one and done, or they're becoming infected. I mean, I've seen people are getting reinfected within 2-3 weeks now. There is no lasting immunity. So it's causing huge neurological issues. I saw, and this is anecdotal and speculation, but it makes sense to me, that mice who are infected with toxoplasmosis lose their fear of cats. They lose that fear that keeps them alive. And I'm seeing this with COVID. And it seems to me that it must be having a similar effect that toxoplasmosis does on mice. People are not appreciating the level of risk that they're under right now. And they are under huge risk.
What was it that made you want to become an advocate for better protections against this virus? You've certainly experienced it firsthand, and you've seen on social media and on television the terrible impact that it's had on billions of people around the world. But what was it for you personally that made you want to stand up and raise your voice?
Nurses are advocates. That's kind of why you get into it, a lot of us. And it's just who I am. And I've always had a fierce protective heart for the vulnerable. And all of a sudden I'm the vulnerable. I was never the vulnerable before. I was the person who was the helper. I was the person who could help you get better. I did that. And now all of a sudden I'm in the unenviable position of being the one needing help, and it's horrifying. So it has only strengthened my sense of needing to advocate. I've seen through social media, which is my big outlet now because I can't hardly leave my house. I've seen all the collateral damage through social media, and it's crushing.
So, what do you think has to be done to finally put an end to this pandemic? It's been 2.5 years, and this pandemic doesn't show any signs of slowing down. In fact, there are new variants on the horizon that pose a very great danger and could potentially restart this thing on a whole new level. So, in your opinion, what has to be done?
We need mass cooperation around the whole world, not just in Canada, but around the whole world, because everybody is traveling. So we need a circuit breaker. We need mandatory masks, especially in school. Um, at the foundation, it needs to be in schools. That's the most important place of all. And we need to encourage vaccinations. There's been so many issues around mandatory vaccinations, which weren't exactly mandatory, but if you wanted to hold a certain job or keep a certain job, yes, they were mandatory. If you can get people to mask, you're going to slow down the transmission. The basic tenet of infection control is you are only as strong as your weakest link. We have so many weak links out there. Masks is an immediate and very economical way of strengthening the infection control chain, prevention chain.
Now, when you mention circuit breaker, it brings to mind the COVID-19 elimination strategy, which is a strategy that's been used in several places around the world, including Atlantic Canada during the first year and a half of the pandemic. Now, also countries like Australia and New Zealand have used this strategy previously before dropping it. And now China is the lone country in the world that still practices this to great success. What do you know of the COVID-19 elimination strategy, and do you think it's possible to achieve this on a world scale? What can we do to really make this the strategy going forward all around the world?
Again, it has to come down to politicians, and it has to come on a global scale. We need to have politicians with agendas to push health and not their own agendas. Unfortunately, that's not ever going to happen. We both know that. We need buy-in from people. It was great to have the circuit breakers in the beginning, but the problem was the science hadn't even gotten to the point where it is now. So we had no vaccines for those circuit breakers. So once those circuit breakers were done, people are right back in the open. All you've done is slow a fire. You have not put it out. And as I told my eldest son today, if you really look around and see who's out there nowadays, there's a lot of people that you'll see, but there's a lot of people like me that all of a sudden aren't participating in society. We're the invisible people stuck in our house. And there's so many of me. I'm not alone. We're the people that can't go out very much because it's not safe for us to go out. So everybody has this appearance outside that it's normal, because you only have the people outside who aren't afraid of it, who aren't so vulnerable, who don't. So people aren't getting a true picture of what's going on. People don't understand what long COVID can do to you. People think that they're bulletproof. I used to think I was bulletproof. I've worked around high-level pathogens for years. Never thought twice about it, to be honest with you. And then all of a sudden you do think about it when it hits you.
Now, can you speak about long COVID, your understanding of it, how widespread you think it is, and the impact that it's having on an entire generation of people? This is a disease that affects children. It affects adults of all ages, to the point where you have previously very healthy adults who are now chronically ill.
I just read a statistic that estimates 25% of adults in the US are afflicted with long COVID. 25%. That's staggering, because some with long COVID are going to be able to work. Many of them with long COVID, like me, aren't. So that is a staggering number when you look at economics, which has never been my driver ever. But I mean, when you have politicians talking about, oh, we're opening up for the economy, actually they're not. They're not. You're going to get short-term opening, and as we've seen with, all the staff shortages around the world, it's because people are dead. There aren't workers to fill those positions. So it's horrifying. My good friend has a 3-year-old niece with long COVID. 3 years old. We have no idea how she's going to come through this. We have no idea if she will come through this, right? And she's not a one-off. I can tell you from working at HealthLink prior to COVID, if you had a hockey team that had a mumps exposure, the phones would light up. Every parent who was in the vicinity of the arena were panicked that their child might be rendered infertile through mumps. They didn't know mumps caused sterility in the beginning, right? That takes years to show. Now all of a sudden we we know exactly what mumps does. We're in the same spot now with COVID, and we don't know what the long-term outcome is. We've only had 2.5 years of data, and it's not being collected in an organized fashion. There's not cohesion around guidelines. It's I think specialty in health is kind of picking their own approach. So, I've just seen the WHO is calling for more research on long COVID. What they need to be calling for is a circuit breaker. Now that we have, let the vaccines catch up so we can get the possibility of a sterilizing vaccine that will stop COVID. It's going to take some short-term pain, undoubtedly, but we're in short-term pain right now, and we're going to head for really long-term pain. So in my mind, it makes absolutely zero sense why any of this is happening. It goes against every humanistic principle I can think of.
Now, you talk about becoming an advocate, or an advocate specifically for COVID-19. This requires a certain amount of accurate scientific information and a certain political perspective. What individuals or groups have you found online or elsewhere that have really recorded the truth about this pandemic and have fought to end the pandemic on a progressive basis without further mass illness and death?
So there's some really good sources on the internet, and I go through a lot. I'm a serial news reader, so I read a lot of stories from a lot of different platforms because I want to have a range. Fox News is not included in that, of course, but I mean, I'm on MSNBC, Al Jazeera, the Tyee, like all kinds of different World Socialist website, a whole bunch of different pages to get a sense of what's going on around the world and different perspectives. I'm very active on Twitter, and there's people up there that I respect who understand the need for safety, who feel the same way that I do, that we do not want to be headed toward, we don't want to be in this mass disabling event that we're finding ourselves in, and that it can be done better. And I honestly, this is the long COVID part of my brain that drives me crazy. I can't think of names, but there are reputable people up there. And the strange thing is the people that would have been reputable in my eyes before have lost all credibility. The CDC, for example, no credibility with COVID, with monkeypox, with polio, with any of it. No credibility at all. And these are a lot of medical journals are starting to come under question now too for the articles they published. Are they peer reviewed? Who's funding them? What other financial interests do the authors have? And I mean, in nursing, we take a research course. We're trained on how to research. We're trained on how to find a good source to suss out the good from the bad, the legitimate from the illegitimate information. That's what we do. And so I'm quite horrified when I see that there's healthcare workers going against every tenet of infection control, of encouraging mass infection, because they are promoting everybody gets COVID. And that's horrifying because, again, it's not a one and done. You can have profound damage with one infection. Every subsequent infection, you're at risk. You're playing Russian roulette with your health. So this is not a public health experience that I ever thought I would have. And so I find the people up there with the same feelings that I have, and that's who I trust.
The pandemic comes out of a society that is plagued with a bunch of other crises. One could say that the pandemic was just the trigger event for the acceleration of all these other crises, whether it's the climate change crisis, the growth of social inequality, the drive towards war and dictatorship. Now, can you speak to some of these issues as you understand them and how the pandemic fits into this bigger picture?
I can't say where the pandemic started, where it was, if it was a man-made virus that jumped out of the lab, if it was intentionally released, or if it was a natural virus that has just evolved. I don't know. There's a number of factors out there, and truly, to me, it doesn't really matter. What matters to me is that there has been a huge wave of people who have capitalized on the pandemic to enrich their, to increase their personal wealth. We've seen it with the grocery stores. We've seen it with a number of big businesses. They're hoarding wealth. And so whether this was done intentionally to start that, I don't believe that it was. I do believe that people have instantly glommed onto it as a way to increase their wealth. We're seeing record inflation with not always a lot of explanations for it. We hear supply chain issues, yada, yada. Well, we're 2.5 years into it. We should have smoothed out those issues. People that do that job are very, very good at doing their jobs. So in my mind, it's clear that people are hoarding wealth during this period, and it's increasing all the other problems we have, social inequality being the biggest one.
There was a recent Oxfam report that noted that since the start of the pandemic in 2020, Canada's billionaires have gotten $111 billion richer. Now that's at the same time that millions of workers across this country and billions of workers around the world are being forced to subsist on less, to tighten their belts, with governments saying that there's no money for higher wages and no money for public services. In Ontario, for example, public sector workers, like nurses, but also teachers and other workers, have been forced to subsist on pay increases of 1% per year since 2019. Now that's courtesy of the Conservative government of Doug Ford, but it's also because the unions have refused to fight back in any meaningful way. What do you make of this huge social gulf? You have individuals like Galen Weston, who owns Loblaws and Superstore, getting fabulously wealthy, while basically the bottom half of the population is living paycheck to paycheck.
Well, first of all, it's no coincidence that the bill that targeted the public sector workers in Ontario was geared to primarily female professions, teaching and nursing. Primarily, a female-oriented profession. So there's no doubt in my mind that this is hugely misogynistic in nature. The unions, I think the union leaderships, the people at the top are very much out of touch with their members. I have no physical proof of this, but what I see in just observing people is that the top union leadership are doing absolutely nothing for the workers. They're not doing anything for workers' safety. They're not doing anything for workers' psychosocial, financial health at all. And yet we're all paying large dues. So it seems to me that there's probably money changing hands to get people to not advocate for their members. I cannot explain it any other way. It doesn't make sense to me any other way, which is very scary.
On the World Socialist website, we characterize this as a divide within the unions between the rank and file membership on the one side and the privileged union bureaucracy on the other. Whereas the rank and file membership has one set of social, political, and economic interests, the union bureaucracy has a completely different set. In a lot of cases, they are among the top 10% of income earners. They have many connections to the political and corporate establishment, and in many cases, they control investment funds in the form of pensions and other managed funds in excess of billions of dollars. So the orientation of this union bureaucracy is not towards the rank and file, but towards the establishment, towards the political establishment, the corporations, in short, the employer. Now, what do you think of this perspective? You were a union rep. What do you make of it, given your experience on the inside?
It was very interesting. When I didn't have a lot of union knowledge before I became the local president. I went to a meeting, they needed a president, so nobody else stuck up their hands, so I did. And that's kind of how I've stumbled into a lot of things in my life, and it's been very interesting. What I found is initially in the union, it was fabulous. they're very equitable in terms of any training that you go for, they pay your mileage, you have a lunch allowance. Like, they're very good at that kind of thing. When you go up to the AGM, your hotels are paid for, your mileage is all paid for. There's tons of training courses on how to manage different issues that you'll come across, how to interpret the contract. It seemed like a really, really well-oiled machine, and I believe it is. What I've since come to understand is that the union locals are the ones that do the work. And they get I call it a cookies and juice budget. So we had a very minimal budget, and we would put on meetings, and we'd have monthly meetings with management just to kind of check in. It wasn't a hugely active local because things were running pretty well, and management and union were very close. So there weren't a lot of conflicts. Now in COVID, what I see is a complete disconnect from union leadership to the rank and file members on the ground who are doing the work of the unions. The unions are good at getting processes in place and structures in place. They are not good at advocating for their members. And that has never been more clear than it is now. So I think that the local members are horrified at what's going on. I don't see that at all in leadership.
Well, one might say that it took a crisis like this pandemic to reveal what was already there, to really put things into stark relief. Because after all, it doesn't matter what sector a worker is in. We're seeing the same types of behavior from the unions across the board, no matter what sector, region, or even country a worker is in. In Ontario, for example, there are 255,000 education workers that are in strike position against the hated Tory government of Doug Ford. Now, this is a government that has no popular support, that is hated within the working class, and yet the leadership of the 5 education unions have done everything that they could to really prevent a united offensive of this workforce against the government. And this is after 3 years of savage pay cuts, almost 3 years of a pandemic that continues to rip through schools, and decades of attacks on public education, not just by the Tories, but by every political party, including the Liberals and the NDP.
Right.
So this is definitely widespread.
They don't want to lose their war chest. I look at union war chests as basically no different than our provincial government's newly created, since the UCP got in, war room. It's money that's not accounted for. And nobody knows what's happening with it. And I have zero faith in the union anymore. My husband had the same experience being a teacher during the pandemic. He didn't have to. He chose to leave teaching because it came to the point where he was going to get COVID. There was no doubt in our minds. He was in an environment that was very, very unsafe. And the school board would do nothing, even though I was so immune compromised at the time. He wasn't allowed to transfer to online learning because they didn't want to lose a teacher, I believe, in his area. So he left. He quit, pulled his pension, took a very, very early retirement, and is working in a position now that is safe, but at a fraction of the pay that he had before. No benefits, no nothing compared to teaching. And the Teachers Association has been as ineffective as the Nurses Association here in Alberta.
Now, a phenomenon that the World Socialist website has reported on and really helped to build is this movement for the establishment of rank-and-file committees in countries all over the world. These are genuine workers' organizations made up of ordinary workers that are completely independent of, and in fact necessarily hostile to, the privileged union bureaucracies who have sold workers out for year after year, now for decades. And there's been a great response to this movement. Workers in Canada, the United States, Germany, Sri Lanka, and other countries have really taken to creating these rank-and-file committees because they're tired of losing. They're tired of the union bureaucracies letting them down, especially in this pandemic. Now, in sectors like healthcare, rank and file committees have been set up at companies like Kaiser Permanente and other large hospital chains by healthcare workers like nurses who are tired of seeing their patients die early deaths, who are tired of seeing their colleagues leave out of exhaustion, out of long COVID. So, really, this is a movement that's on the rise. What do you think about this movement to establish rank and file committees? Do you think that it's a way forward for workers in healthcare and other sectors to really realize the kinds of gains that they need and to be able to put an end to this pandemic?
100% I do. I think unions are dinosaurs. They've become so entrenched in the law, in the bureaucracy, that they have become the very thing that they were fighting against. I don't view them, in my mind, they're the same thing as the corporations. They're no different. They have it embedded into law that dues must be paid. So they have guaranteed income, right? They have guaranteed income with doing absolutely nothing. They don't have to make the workers happy anymore. Everything that they fought for, the right for workers to join a union, for dues to be collected, that's all enshrined in law now. So they have no reason, other than morally or ethically, to do anything, and that's clear. They're not doing anything. So rank and file committees, in my mind, are completely 100% necessary. I think the unions have become, in many cases, so big and so corporatized that basic communication between worker and manager has been lost. And everything gets deferred to the union or upper management. We need people on the ground who can and will make the necessary decisions.
Carrie, would you support the creation of a rank and file healthcare workers committee in Canada? And if so, what would you like to say to the hundreds of thousands of healthcare workers in this country who are fed up with the way that the government and businesses have treated this pandemic, fed up with low pay, fed up with overwork and the lack of staffing? What would you like to say to them to encourage them to join you and really help build this network of healthcare workers rank and file committees across Canada?
What I would like to say to my healthcare worker colleagues, all my worker colleagues across any sector, nation in this world, we're tired. We're all tired. Those of us in healthcare and education on the very front lines of the pandemic, and the retail associations, we're tired. We need to find a little bit more fight in there to oust these unions, to get back to get our rights that have been trampled. This is the fight of our lives. We are firmly in the driver's seat. There is no doubt about it. The workers constitute the vast majority of the population. There is no question about it. We have the power. We have to take it. It's going to mean a lot of people who consider themselves to be regular, average, law-abiding folks are going to have to make decisions to maybe carry out a general strike. And those decisions will not be ever sanctioned by the union because they have too much to lose. So we have to take our power back. We have to take our power back. This is our chance. This is our best chance. And if we don't do it now, before people are even more exhausted and more sick, we're going to lose that chance. And we're going to be back in a feudal society in no time flat.